Hi, I'm Chris. I'm a trauma registrar from Oxford. Just want to say thanks everyone for joining us on July the 12th for the Complex Fractures Research Workshop. And now I'm just going to tell you a bit about what it's all about and what to expect. So first, just to remind everyone about when we talk about complex fractures, what do we mean? Well, we've used a nice definition, which is around fractures that are coming through the skin or open fractures, patients with multiple fractures at the same time, patients with fractures around joints that are broken into multiple pieces, and fractures of the pelvis and acetabulum or hip socket. But it's not just confined to these four types. It's really anyone that's going to need extra support, beyond the norm, particularly. So it might be patients with nerve injuries, or it might be patients that have got simple fractures, but they've got other complex health needs. And I'll mention that again in a moment. So an overview, we're going to talk about how research is funded in the UK, going to talk about what the Complex Fractures Partnership was and what the purpose of the workshop is. So how research is funded in the UK, there are broadly two ways that that's done. It can either be researcher-led, that's where a researcher comes up with an idea, they then go to a funder and say, can I have some money to deliver this study? And the funder will either say yes or no. Or the funder identifies an area of unmet need and identifies a study that needs to be done or researched. They then put that out, that call out, and then people put their hand up and say, yeah, I think I can deliver that study, and away they go. And so this research workshop is really about aligning to that second option, the commissioning phase, because the government, the NIHR and funders, they are looking at healthcare from all aspects and walks of life, all sorts of different medical specialties. So it's really hard for them to get an idea of, what are the specific important research questions that need to be answered. And so this whole process is about trying to guide that. And the James Lind Alliance is really the gold standard in doing that and delivering that. So the idea is that the James Lind Alliance comes up with priorities that are important to healthcare professionals and patients, and then that feeds into this commissioning process. And in particular, it's relevant to these work streams. So there's the efficacy and mechanism and evaluation, which is about early phase clinical studies. There's health and social care delivery and research, which is more about the organization and delivery of healthcare. There's the HTA, which is about comparing one or more commonly used interventions, but seeing which work on a big scale. And then there's also public health research. And we've got some representatives attending on the 12th from these particular work streams to give us a bit of a steer. So the Complex Fractures Priority Setting Partnership, that was started in collaboration with the Orthopaedic Trauma Society back in October 2019. And so we've got a steering group together of around 10 to 20 patients and healthcare professionals. We sent a survey out to around 500 people. They then said, this is what we think needs researching. This is important in this area. We collected all those together. We smushed them together. We then searched the evidence to see what questions had already been answered. We then sent out around 60 questions back out to everyone, and thanks to everyone that participated and ranked those questions. We whittled that down to 18, and then that went to a final workshop where we whittled it down further to the top 10 that you're about to see. And overall, there were 500 questions submitted by just under 300 healthcare professionals and patients. And at the final workshop, there were 16 patients and 13 healthcare professionals. So just to say, the patient voice was incredibly important and valuable. And, it's really what the James Lind Alliance and this process is all about. This is just an overview of all the responses we got, and you can sort of see there was a good spread from all around the UK. And then this is a little photograph of the final workshop, and you might be able to pick it out yourself there somewhere. What that produces is that these top 10 priorities, and what these really are, these are top 10 priorities ranked in importance to patients and healthcare professionals. And now they're out there. This has been published, so researchers or teams can come out and pick that priority and then go to a funder and say, look, I think this is a research study that needs to be answered. But as you'll see, they're not really research questions right now. They're still quite broad. So even if a funder picked up these top 10 questions, they would still be thinking, well, what exactly are you talking about? What exactly needs to be researched? So again, in the infection, number one here, how to reduce infection. Well, how do we do that? Is that about giving antibiotics? If so, when, how, where, who? So they really need a bit more of a steer to understand what needs researching. And thanks for everyone that submitted your PICO questions. Hopefully you got your head around PICO now, which is participants, intervention, comparator, and outcomes. And the reason we do that is just it makes it a bit clearer both for everyone during the discussion, and also most of the funders sort of understand that method. And clearly not every question here is necessarily fits into that PICO method, but it just means it just makes it a bit easier to discuss. So thanks for sort of bearing with us and getting those PICO questions in. And so that's really the purpose of today. We're going to discuss each of these in turn in your small groups, and we're going to say what specific questions need to be answered, what specific research studies need to be done, and who exactly is that do those need to be done for? Is it just patients with open fractures? Is it patients with all of these sorts of injuries, or is it patients that maybe have simple fractures but they are complex in other ways? So perhaps they're diabetic or frail, or they've got other health needs. And so that's what you're going to really get down into the nitty-gritty of today, to come up with some nice clear PICOs that we can then give to funders. And the idea is we'll come back at the end of the day and we'll feedback, and we'll try and for each group we'll try and present 2 or 3 of their top PICOs, and we'll discuss which questions are ready to go to give to funders, and which questions maybe need a bit more background work first, so that in 3 to 5 years time, then they can have a big research study to answer them. So that's the plan. There will be a lot of guidance from your facilitators, and for now, just enjoy your journey in, and I look forward to seeing you on the 12th. Thanks.